Okay, that's running, and I can edit.
Okay, ready?
Go ahead. Yeah.
So Alice, you were one of our first hospice volunteer for our first hospice patient.
Yes, that's right, and I was frightened,
Mm-hmm.
but it was a wonderful experience, absolutely marvelous.
And now you are still involved in hospice, but in a little different aspect of it.
Yes, that's right. I'm now a resident at High Acres, and hospice serves me in a wonderful way.
And how do we help you? How do we serve you, Alice?
Well, a registered nurse named Lisa, who is absolutely marvelous, comes to see me several times a week, checks all my vitals, visits with me where my pain level is at. And it's just nice to see her smiling face and to visit a bit with her. She is just a charmer.
And Alice, how has hospice changed from when you started as a volunteer to this time when you're now finding yourself as a patient?
Well, it's quite different to be a patient than to be a volunteer, obviously, but my volunteer days were wonderful because I hesitate to call it, it was rewarding is the term I guess I like to use, because we got to intermingle with not only the patient but also with the family, and I treasured that time I was able to spend with them.
And do you still find that hospice is rewarding to you in the opposite aspect?
Absolutely. When they came and one of the nurses came and visited with me about my reaction to calling hospice in, I said by all means, because I know how they operate. And I know they're wonderful with pain control, and my level is a bit high, so that was a wonderful opportunity.
And do you feel like your pain is being well controlled with hospice caring for you?
They're doing everything they can, and they certainly have gotten it to a much lower level. They've been very persevering in pursuing that.
And at one time, Alice, you were concerned about hospice not, if you do so well, that hospice would possibly be discharging you. Is that still a concern? We've discussed that.
It is no longer a concern because I've been convinced that they will be here for me. And I really appreciate that. It's a very assuring aspect of my stay here because I know that they'll be right beside me. And I have witnessed that with others, and now I happen to be the recipient. And that's really special.
Thank you. That's
I
great.
blundered a couple times.
I blundered more than you did. Goodness.
Now, what's wonderful about this is basically there's about 3 minutes here of a conversation that we can use as a video to show other people first of all, to show you and tell people who you are and what you've done and kind of where you are right now. And also it gives us a chance to tell the world about Lisa and hospice. And you said things that if I said those, nobody would pay attention. You saying it will catch a lot of people.
I got a little choked up.
You could tell. Makes a big difference.
And I don't do this. When I did this, I was trying to tell her that I was getting teary-eyed.
Yeah, you did well. You did really well.
So what I'm going to do is take it back and we'll put it together and edit it and have Lisa take a look at it. And when you're happy with it, then we're gonna put it on YouTube, and people here can take a look. You'll be able to see it. And the radio spot, I'll have, we'll record that, and it may show up on the radio, like KSJB and a couple of the other stations.
See, I didn't know exactly what was entailed. I knew it was going to be.
Is that
well, we're
is
sort
that bad now?
No.
Well, you signed off on everything. We have permission.
You know what, Alice? We don't have this opportunity to have someone that did start with hospice originally, and now to be on the other side of that. So we appreciate.
Did I address that properly?
You did, and my questions weren't the best questions either.
But no, they were excellent questions. You just said it's different. You said it's really different today than it was then. And if there was one thing that was really different, we'll put that on.
Just a minute, I got to think about that a little bit.
All right, so Alice, I have a question, and thank you for allowing us to be here to talk to you. What is it that's changed dramatically in hospice care in the last 15 years?
I don't see very many drastic changes, but I think that over the years they have become extremely should I say, more efficient. Not that they weren't in the beginning, but it was a learning experience for all of us because hospice was new in our community. We had a wonderful coordinator at that time, and we have continued to experience that. And one thing that might have changed is I think they have a little larger staff and are able to reach out a little more, and that's wonderful.
So is there somebody available for you to talk to or come to see you all the time?
Absolutely. I have 24-hour access 7 days a week to the hospice office, and if I need nursing care or need some changes made, they're readily available.
Okay, so we look forward to seeing you for a number of times. Maybe we'll do an update on this in a couple of months. How's that?
I guess it's okay. Thank you.
Thank you. Great.
Yeah, if you want me to ask those kind of questions, you got to hand them here.
Well, I didn't know, is that right, to this larger staff?
Yeah.
Yes, that's right. And I was
So it'll be louder when it gets on the...
But it was a wonderful experience, absolutely marvelous.
And now you are still involved in hospice, but in a little different aspect of it.
Yes, that's right. I'm now a resident at Acres, and hospice serves me in a wonderful way.
And how do we help you? How do we serve you, Alice?
Well, a registered nurse named Lisa, who is absolutely marvelous, comes to see me several times a week.
I didn't even pay her to say that.
I know, there was no pain.
Where my pain level is at. And it's just nice to see her smiling face and to visit a bit with her. She is just a charmer.
And Alice, how has hospice changed from when you started in as a volunteer to this time when you're now finding yourself as a patient?
Well, it's quite different to be a patient than to be a volunteer, obviously, but my volunteer days were wonderful because I hesitate to call it, it was rewarding is the term I guess I like to use, because we got to intermingle with not only the patient but also with the family, and I treasured that time I was able to spend with them.
And do you still find that hospice is rewarding to you in the opposite aspect?
Absolutely. When they came and one of the nurses came and visited with me about my reaction to calling hospice in, I said by all means, because I know how they operate. And I know they're wonderful with pain control, and my level is a bit high, so that was a wonderful opportunity.
And do you feel like your pain is being well controlled with hospice care?
They're doing everything they can, and they certainly have gotten into a much lower level. They've been very persevering and pursuing that.
And at one time, Alice, you were concerned about hospice not, if you do so well, that hospice would possibly be discharging you. Is that still a concern? We've discussed that.
It is no longer a concern because I've been convinced.
I look like I'm here on vacation.
And I really appreciate that. It's a very assuring aspect of my stay here because I know that they'll be right beside me, and I have witnessed that with others, and now I happen to be the recipient, and that's really special.
Perfect.
My voice cracked a couple times. I'm sorry about that.
It's okay.
For allowing us to be here to talk to you. What is it that's changed dramatically in hospice care in the last 15 years?
I don't see very many drastic changes, but I think that over the years they have become extremely, should I say, more efficient. Not that they weren't in the beginning, but
Oh, you were watching.
it was a learning experience for all of us because hospice was new in our community. We had a wonderful coordinator at that time, and we have continued to experience that. And one thing that might have changed is I think they have a little larger staff and are able to reach out a little more, and that's wonderful.
So is there somebody available for you to talk to or come to see you all the time?
Absolutely. I have 24-hour access 7 days a week to the hospice office, and if I need nursing care or need some changes made, they're readily available.
So we look forward to seeing you a number of times. Maybe we'll do an update on this in a couple of months. How's that?
I guess it's okay. Thank
Okay,
you.
thank you.
Thank you.
Perfect. Alice, you did so well.
That was great.
You're a
I'm
natural.
nervous Thank you.
You're a
But
natural.
tears come come out easy, and that's what it was hard. I hope it doesn't indicate on there, but I've always cracked a little.
All you can hope for, when I'm doing this, what I hope for is just that the people that are here, I mean, that I'm filming or shooting, feel comfortable enough to express themselves as in any way they want, and that they're really saying what